Assalamualaikum warahmatullahi wabarakatuh, and I hope that everybody feel comfortable now to continue with our lecture today. Right, this lecture is basically will focus on the topic of medical negligence. Okay, medical negligence, and I will base the lecture here today based on the material that I shared with you from early of the semester, or early 2 weeks ago. Right, so in the previous lecture what we had discussed was the topic on negligence itself, and I hope that all of you already understood the meaning of negligence and also what are the elements that must exist in order to constitute a negligence. There are 4 elements altogether. Arba, right? Wahid, that is duty of care. Ithnain, breach of duty. Salasa, causation. And arba is the damages or injury. So all these 4 elements must exist, must coexist at all time. If any of these particular elements is missing, then there will not be a negligence case. So if we become the lawyer to bring the case of negligence, and we want to argue on behalf of the plaintiff, that is mudda'i, then we have to make sure that all these elements are fulfilled. That was the topic on negligence, and where we had discussed the topic of Donaghy against Stevenson. So today we move on also in the topic of negligence, but we'll go specifically to the medical negligence. Medical negligence. So sometimes the topic or the title or the wording of the medical negligence also known as the clinical negligence. Certain textbook or in the Google, sometimes you type medical negligence, there is not there, but you can find clinical negligence. But sometimes certain textbook, certain materials, they use malpractice in the medical malpractice. Basically what I found, the materials about the in Saudi law, for instance, they use medical malpractice. So whether it's medical malpractice, clinical negligence, or professional or medical negligence, is actually referred to the same thing. Okay, so today we are going to look to the meaning of medical negligence, and then we are going to proceed with the what are the elements to constitute medical negligence, and we are going to look into 2 cases. So today's lecture we just look into these 2 cases. So maybe after this you can have a look other cases. I will share with you other cases as well, but for today's is only 2 cases. So I just choose 2 cases which we call as the leading cases in the medical negligence area. Okay, medical negligence. What is medical negligence? Okay, in medical negligence, right, it is medical, then you may have like a person involved in the medical profession or in the medical industry or in the health industry. For instance, we have a doctor, right? That is medical negligence. A doctor involved, a doctor in the medical industry, of course, doctor in medical industry. Then this person, if they commit negligence, so we call it as a professional negligence. Who else in medical? Maybe you have nurses, right? You have nurses. Nurses also, if they do something that may cause damage or harm or injury to their patient without exercising a standard duty of care, this person may be liable for medical negligence. Nurses. You have surgeon. Okay, who else? You may have dentist, for instance. Okay, so those are the persons that who probably, if they fall, if they commit negligence, or then this person is considered as committing not an offense. We don't say an offense because offense is criminal. They may be liable for medical negligence. Okay, right. So we want to look now, move on. What are the elements of the medical negligence? Right. What are the elements of medical negligence? Right. If we Okay, these are medical negligence. I just show medical negligence. What are these elements? Okay, if you like to recall the elements of negligence that we had discussed earlier, there are 4, right? As I said to you in the beginning of the lecture. Number 1 is there is a duty of care, right? So number 2 is breach of duty, right? Number 3, causation, and number 4 is damages or injuries suffered due to the breach of duty earlier, right? So damages or injury. Okay, these are the elements for negligence, only negligence. But when we talk about medical negligence, we have 2 more elements that must be proved, right? We have 2 more elements that must be proved other than these 4 elements. What are those elements? I'm referring to page 13 of your materials. The other 2 elements are number 5, professional misconduct, right? Professional misconduct. What is professional misconduct here? Professional misconduct as the professional, right? Because we may have, a doctor will have their own board of medical, where they have certain guidelines, they have certain criteria or policies that are applicable to their industry. So if this particular guidelines or policy, or we call it as the standard operation procedure, or we call SOP, governing that particular profession, then this particular professional, if the doctor here breach of this particular guidelines or procedures that given or provided by the medical board, that will amount to the professional misconduct. Okay, and the last one, the 6th element that must be proved by a lawyer if they want to sue or bring a case against the a doctor, that is failure to comply with the standard of care. Failure to comply with the standard of care that established or exercised in that particular industry. Let's say, we give an example, if a doctor has to perform a surgery, a doctor will have their own team of that will go to the operation theatre. Okay, their teams probably, if a very major operation, their team members would be 3 doctors, for instance, depending on the complication of the case. If you're talking about heart surgery, for instance, that is very major operation, then they may have 2 or 3 doctors attend to one particular patient. So what are the standard of practice for this particular doctors? They must be qualified. They must be probably having certain certificates, for instance. And in the team of this medical team also, they may have another professionals. They have a trained nurse that will attend to the patient right after the operation, for instance, and there are other members to the team as well. So in order to perform one particular surgery, there will be a standard procedure that must be followed by a doctor or by any members in that particular team. So this we call it as a SOP or standard of practice that must be followed. So if they fail to comply, that will amount to misconduct. Okay, and if that is now is actually what I'm saying to you just now is actually explaining the number 5 and number 6, because I believe the first element you already understood earlier, that we discussed the case of Donnie Stevenson, we discussed the case of Wagon Mount, but in explaining the point number 5 and 6, how we relate the negligence to the medical professionals. Okay.